record of this. Before we get started, I'm also going to share my screen. Please, everyone, give me a thumbs up if you can see the agenda.
Yeah, I probably should have waited for you to finish the sentence. I just gave you the thumbs up when you asked for it, but
I like the thumbs up. It's really good. I'm just going to stretch out the screen so I can see as many people. Don, please go ahead.
Yeah, welcome everybody. I was gonna make a comment about, how it is clear and cold here, but after hearing what Kristen had to share, it's not nearly as cold as what some of you are dealing with. We're gonna do the roll call a little bit differently today. We're gonna do roll call of the steering committee members, but anyone who is in attendance can sign in via the chat. Just type in your name and your organization that way we'll be able to get through our agenda just a little bit quicker, because we know many of you may want to attend the FTA webinar, which is directly after this meeting. So Richard, you want to kick us off with the steering committee members?
Sure, I'll start with the steering committee, or it'll be the steering committee. So I see Don's on the phone or online. We have Jen. Brody from Colorado, are you on?
I am here, thank you.
Wonderful. Wiley from Alabama? Not yet. I see Andy from Michigan, Mark from Texas, Kristen from Iowa, Caitlin from Tennessee, Liz from Florida, Shelly from New Hampshire, are you on?
Yes, sir.
Oh, there you are. Thank you. Charles from Mississippi. And my other favorite Mississippian, Shirley, are you on?
I'm on.
Wonderful, thank you. And last but not least, Dave from New Mexico. Dave, are you on? I thought I saw you. All right, hold on one quick second. Someone's joining us at a 480 number. Who's joining us on the phone? I'll unmute you and I can. No, I guess I can't. All right. Don, I'll turn it back over to you.
Oh, great. And so for those of you who are still clicking in, and go ahead, feel free to enter your information into the chat, and we'll make sure we have a complete roster of everyone who attended via that method. Our first thing up is to discuss the MTAP action alert results and have a discussion about the COVID-19 vaccination of transit workers and transit accessibility. Caitlin, I guess it's up to you.
Hey, everybody. So hopefully, we got some good responses to the action alert, but hopefully we can have a little bit more discussion about those responses here today. And Richard, did our friends from the CDC sign on?
Yes, they did. Would they like to introduce themselves? Please feel free to unmute. I see Carl's on.
And as Carl tries to get on, I'm also Jennifer Lincoln from CDC NIOSH.
I'm with Carl and Jennifer Lincoln. This is Cami Shemot-Menendez, also from NIOSH. Thank you.
Hi, I am Liz Ryan, and I sit on the COVID-19 Vaccine Task Force. I work with our communications team as well as our vaccine confidence team. And I am a liaison to Carl and his team, so he invited me to join today. Thanks.
I see Wendy and Carl. Carl, if you're going to try to talk, you need to unmute.
Sorry, got the wrong thumb. Everyone's has a quicker trigger finger than I'm Carl Sieber. Also, we're all from the National Institute for Occupational Safety and Health. We're located at various locations. I'm in Cincinnati, and the others are in Morgantown or Washington, D.C. And we're all members of a essential workers team, which CDC, we're part of CDC, is standing up right now to look at vaccination of our particular responsibility is transportation workers. And this particular survey caught our interest. I think you collected some very interesting information, which we would certainly like to discuss further with you when we get that point. Thank you.
And Wendy?
Oops. Hi, thank you for inviting me to the meeting. I work for the Centers for Disease Control, which is where Carl works as well. He's, as he mentioned, his specialty is essential workers and occupational safety and health. I am the public transportation lead, but from in a different part of CDC, which really looks at transportation through the lens of equity and health issues. And as a result of that work, I have a lot of partnerships in FTA and outside FTA, which is how I got to know Richard. And that's why I'm here today.
All right, thank you all for being here. So I'll give you guys a little bit of a background on sort of where this action alert came from really quickly so that you can understand kind of where we were coming from with the questions. And then we'll have Richard start going through and we can talk about the responses. In Tennessee, so we reached out to Richard a couple of weeks ago because we as the DOT were contacted as part of a request to the governor of Tennessee by our Transportation Association for Tennessee. We have transit in all 95 counties, as you've all heard me talk about many times, and 26 transit agencies provide that service throughout our state. And they came together to request that they be moved, their workers be moved from the 2A phase of vaccination to the 1B phase, which is happening now. The 2A phase is not expected to roll out until the second or third quarter of this year. Tennessee's Department of Health had just recently moved correctional officers from the 2B phase or 2A phase to the 1B phase. And when they did that, they cited concerns about correctional officers having direct exposure to the public in confined spaces. And so when the transit agencies saw that shift happen, they kind of said, whoa, hold on, what about us? Our transit agencies have provided 12 million trips within the confines of the pandemic. And every single one of them came in contact with a transit provider, as many of you know in your states too. So the letter that they submitted to the governor asked a TDOT, the commissioner, for more information about what other states are doing. Where are transit workers in other states' rollout plans? Aside from reading everybody's plans, we reached out to Richard to get some more feedback on not just where are they, but where are you in your vaccination rollout? Where's the prioritization happening? What has been the response to vaccination? That sort of thing. So that's kind of the background of where this came from. And right now, the Department of Health in Tennessee does not sound like they are open to moving transit workers up to the 1B phase, which is disappointing. But hopefully we can come back armed with some more information and perhaps some support from our friends at the CDC to kind of guide the decision makers in a direction that puts our transit workers in a safer position. So with that, we'll go to the first question that we asked. And overwhelmingly, yes, most of your states are using the CDC phase designations. Some of you did not know, and if you don't know, hopefully this question maybe prompted you to look or ask around. And then some of you said no, and then there were some explanations there where your states have kind of played around with where everybody is at. Now we only had 22 responses to the action alert. So if anybody on here did not get a chance to respond or now has an answer, please hop in and discuss with us what your state's status is for any of these questions.
Yes, this action alert is no longer live. So if there's folks that want to wait at this point, now's the time.
All right, or yeah, use the chat.
All right.
All right, so then that kind of leads into the next question. Where is everybody? It seems like everybody's in the very beginning phases. We've got a few that are maybe entering phase 2. Texas is in 1B2, all right. And I know that some of these answers were hard to probably come up with because everybody, the rollout of vaccinations has been focused on the local level, perhaps. I know in Tennessee, a lot of our distribution has been based county by county. And so some of our counties are further along than others, or some have absolutely just completely run out of vaccines altogether, while some are continuing. So some of our counties are stuck in one place, while others are continuing to move forward. Was there any feedback on any of these other than folks in the chat telling us where they're at? Seems like most of the chat people are in 1B as well. Nope. All right, just information. All right, Richard, let's keep going. So this one was geared towards, does your allocation plan specify a phase 4 public transit drivers? Now in Tennessee, I said that we've got transit drivers called out in phase 2A. Overwhelming majority, yes. A few of you didn't know, and then there were some no's. Looks like Iowa doesn't know either. Go ahead, Richard, to the responses. Oh wait, that one didn't have responses.
That was it on that one. But if you want to look at the percentages, we can easily skip down to what they were. I mean, overwhelming, 17%. 17 members answered yes, 77% answered yes. A little less, about 18% answered no, and one answered no, I don't know, to this particular question.
So if anybody that answered no, I'm curious to hear, have your transit drivers or your association or agencies, have they been reaching out to you asking? Because when we were kind of caught off guard that we were asked by the association to weigh in on where transit workers should be, because we had not been asked throughout the pandemic to weigh in on too much at the governor's level. Shelley, did you have a response there?
Yes, so New Hampshire was one of the states that answered no, that we don't have a certain phase for public transit drivers. All along, our commissioner has been working with Health and Human Services on the plan, and we've been articulating the need for that. The earlier iterations of the plan had transit drivers in an earlier phase, and then the state changed its approach and was going for those who were more at risk for serious health conditions than it was for those such as transit drivers who may be in close contact with the public. So that shifted pretty quickly. And transit drivers in New Hampshire are at the whim of whatever category they fall in based on their age or any personal medical condition. So we don't imagine all the drivers will get vaccinated at one time. That'll happen throughout the other phases based on that individual person's factors.
This is Kristen from Iowa. We're very much at the
whim or interpretation of each county, of which we have 99 in Iowa. And each county is able to say whether or not they think transit fits into the definition of what each phase covers. So in some counties, they've vaccinated transit employees based on their employment. In others, they say that no, they're not qualified because transit's not specifically spelled out, and it's really a hot mess. We have no statewide direction on this. I'd really like to see, national direction on this, preferably, but yeah, it's not well organized.
This is Carl. Thank you for that last comment regarding placement of transit workers in the ASIP tiers. Actually, that same question has come up with other groups. So if anyone has any further comments about that, that is one of the points we'd like to discuss further in our team.
So I know in Washington State, our unions were pressuring the governor to designate and the counties to designate before this list even came out, and trying to figure out where they were going to be and advocating. It's interesting that obviously the majority of the unions were fighting, and union membership were fighting for vaccination. And then there unfortunately is also a sizable minority of those who say, and we want it, but you can't make me. And so it's kind of cutting a little bit both ways at this point.
Yeah, and Don, that kind of cuts into the questions towards the end of this, kind of touch on that double-edged sword where, in Tennessee, we're seeing as well, where we're fighting to get them drivers pushed up in the rollout, but there is still sort of the trepidation among drivers whether or not to actually receive it. Wendy asked a good question in the chat. Do we have a sense of whether transit workers are getting vaccinated outside their workplace? And what is the average age of your transit workers? I'm not sure what the average age is for Tennessee transit workers. They do trend a little bit older. So they would probably be in that age group range. They'd be able to get it sooner. And I know that some of them have been able to use the non-emergency medical transportation, that part of their job to get into the vaccination phase a little sooner. And I think that's one of the questions coming up next, Richard, actually, if we want to pop down. But if anyone else has answers to Wendy's question.
Put it in the chat.
Yeah. All right, so then it seems like the overwhelming majority of responses for this one, where are public transit workers, if they are named in your plan, what phase are they in? It looks like a lot of them are in 1B, which I am going to use this this question and these responses in this chart to share with our upline in Tennessee. And then there were a sizable amount of other responses with some explanations. It seems like Ohio is still evaluating what happens after the 1B phase, and then most of it's just age related. So if you're an older transit worker, you're going to be closer to the front of the line than the back.
And again, please understand that this is just a sample of what we pulled from the action alert and the responses. There were 7 responses. So it's a small slide, so I can't really fit. I wanted to sort of have it legible, but we will be posting all of this information, sending it out to all the members, as well as posting it to our MTAP members only site as well, as we do with all of our action alert info.
All right, so Richard, let's keep going. And I want to leave time at the end for us to discuss, especially with Carl, about maybe how we can coordinate a more national response to this. For the non-emergency medical transportation, are they receiving a higher priority? And this was a question mostly because in Tennessee, we have seen success in kind of pushing, especially among our rural providers, getting them to the front of the vaccination line because they provide this NEMT service. Our urban providers, our fixed route providers have not been successful, obviously, in this vein. So we were curious how many other states were seeing success here, or if you weren't, or you hadn't thought of it. It's a good strategy if you can get the county on board. So a lot of it was, I don't know. So hopefully this prompted a research project. Let's see, and I think it's a lot of 5311, 5310 eligibility there. Looks like we got some good conversation going on in the chat. So Richard, let's go on to the next one. I think this is where our CDC folks will weigh in a little bit too. You know, what percent of transit drivers have received the vaccination? And it looks like the majority is between 1 and 25%. And that was about where Tennessee was as well. Which is concerning because of all of the everyday exposure that our drivers are having to the public, especially since we are taking them to doctor's appointments, taking them to testing sites. You know, and only 25% of the driver population being vaccinated is concerning. So is that, and please hop into the chat or jump in and discuss this. Has your state even looked at this yet? I know that this question, what percent of your drivers are vaccinated? We didn't even kind of think of it until we started talking about it. And then we did a survey, and I think George just put in the chat, Tennessee, we did a survey of our agencies just to see. We sent them out an email and said, hey, how many of your drivers are vaccinated already? Because we hadn't really thought to ask yet. I am curious who's at 50 to 74% of their drivers vaccinated. Are you on the phone? There we go. Brody's going to do a survey. All right, Richard, well, we can move on then. And then this one, we actually had a very spirited discussion last week with our trans association about this issue. When I brought this up to them, I got a heated reaction from at least one of them about how, you know, driver reluctance is a red herring and we shouldn't be focusing on it. But I do think it's important in our roles as the DOT probably to support the agencies in any way we can to help them get their drivers vaccinated, even if it's assisting them in the education piece of it. But Carl and your team, what were your reactions to the responses on these last couple of questions specifically?
This is Carl, and others on our team, please chime in. This was, your responses were pretty much what we have heard and discussed on our team also. There are a couple of interesting ones. Could you flip to the next slide? Religious beliefs, the probably political stuff. No, we've been talking a little about where people are going to get these vaccinations and type of vaccination. And of course, the side effects and long-term effects, that's something still under consideration. So in general, these were similar to what we've been talking about. I appreciated the questions here. Jennifer, Cami, Liz, did you have any additional thoughts on this question?
Hey, this is Liz, and I apologize. I did not see the results before this call. So I'm just sort of thinking as I see this on the screen right now. These are certainly things that we have heard from other groups, nothing too surprising here. I think that something that we need to consider, though, is that in some cases, getting them the right information may be helpful. For example, if they're worried about the quick trial period, it can be helpful to, give more information about how these vaccines were developed quickly without cutting corners when it comes to safety. It can also be very helpful to, talk about the very robust systems that are in place for monitoring the safety of vaccines, both during the clinical trials and once they're actually out being used. But in some cases, I think the issue is fundamentally one of trust, and one of having the right messenger. And those can be a little trickier to address. I sort of see that a little bit in the Indiana response here. Political. I assume that means that the whole vaccine rollout has been politicized. There may be some lack of trust in the federal government here that's coming through there. The religious beliefs, again, those are, really some deep-seated things that may be hard to address with actual messages. But one of the things that we are doing is trying to build partnerships with trusted messengers at the community level, including faith-based leaders. So, but I think the big takeaway is that, vaccine hesitancy is often very complex and not something that can easily be addressed with factual messages, although in some very specific cases that can be helpful if it's specific concerns that we have information about. Thanks.
Thank you.
I should mention also, one of the other concerns we've heard about is medical conditions potentially disqualify people from receiving the vaccine. And I have to admit, maybe this is my ignorance, but for example, in truck drivers, they undergo medical exams, and so they have to be certified. Is among the population you're working with, is there a licensing or a medical exam which would sort of eliminate problems like that with medical concerns?
Yeah, the drivers get DOT physicals.
Oh, they
or at least
all do for
most of them do.
licensing. Okay, thank you. Sorry for my ignorance there.
No, you're good. All right, Richard, we pop down to the last question, I think, right? There were 10. There we go. And then coordination for access to the vaccine site. Tennessee just worked with the Department of Health to push out information to Tennesseans that you can walk or bike up to a vaccine site and to testing sites. It was not part of the guidance from the Department of Health until a couple of weeks ago, that non-car folks could access these sites. And a lot of our transit agencies are working to get people to testing and vaccination sites. I know one of our urban areas, Chattanooga, has dedicated one of their bus barns to a drive-through testing and vaccination site. What other agencies said yes that are having some success in coordinating access? Oh, you all are so quiet today.
Come on, y'all. Send us a chat. Unmute yourself.
This is Kristen. I just yesterday had a conversation with our Department on Aging and the head of our association of our area agencies on aging, because they will soon be getting lots of phone calls about vaccine sites and from the elderly population, and people will presumably need some transportation. So they're wanting to team up with us and figure out what we could provide. So we're in the preliminary stages of talking through that and figuring out that coordination. So yes, we are starting to work with our AAAs on that.
All right.
Shall we see the detailed answers?
Yeah, let's pop down to those. So it looks like Minnesota, y'all are having some conversations.
How about Minnesota? How about, is Tori on the line? Could she talk a little bit more about what's happening in Minnesota? I know Tori's on the line. I see her.
I'm on the line. All right, so what's happening in Minnesota? We got kind of an exciting thing going on, but we haven't talked to FTA about it yet. So I don't know if I'm gonna get in trouble here, but we will be talking to them. But we were trying to retrofit some buses to be mobile clinics. And then the mobile clinics, you know, the intent is for people to go to the vaccination sites to get vaccinated, but maybe in some of like the lower income places, or even the LG, I'm so terrible with that acronym. But the lesbian, gay, transgender, those kind of populations too, to bring the buses to those areas and then have the mobile clinic in our buses. So we got 4 buses in the metro area that have beyond their useful life that we're working on retrofitting. And we're looking now for greater Minnesota to see if we can find some buses maybe in greater Minnesota and do that same thing. And then the intent of the Minnesota Department of Health is also to use that as marketing, that, you know, it's safe and it, you know, it is something that you should do and it is for everybody. It isn't just for, you know, so anyway, that MDH is definitely trying to use it as like, yeah, kind of that message that, so still in the beginning stages, but we're trying to do mobile vaccine. I'll let you know how it goes.
I promise not to say a word to FTA.
Yeah, the cat might be out of the bag now. Oh well, it's a good idea. So I'm sure they'll love it and work with us. They always
Yes.
do.
Thank you.
I'm interested to hear how that goes. Well, if there's not a lot of conversation on these points, I'll probably go more general here and kind of hop onto what Kristen talked about a little earlier.
We actually have one more response. One
did we?
more
Sorry.
slide. And this one I tried to put a lot into it because I thought it was worth it.
Yes. Impediments and challenges. It seems like the decentralization of the rollout is contributing to some challenges, maybe some confusion from the DOT level, at least, of what our role is and how we can help. Specifically in Tennessee, obviously, like how can we advocate even within our own, you know, our own executive chain for the needs of transit vaccination, you know, worker vaccinations, but also how do we get these things distributed, and how do the transit agencies in our states factor in? Sounds like Vermont, y'all are doing a pretty good job.
Vermont, you want to unmute? If they're on. Well, Caitlin, I know Oregon, I think saw Marcia is on.
Yeah, I thought so too.
I would love to see, I'd like to understand why local county health organizations are coordinating as in, you would include that as an impediment or a challenge. Love more explanation, Marcia.
I don't think it's, now, in some cases it's an impediment and in some cases it's a help, right? What it's resulting in is inconsistency. Some agencies that have a good relationship with their local health authorities are able to make a good argument that kind of lump transit operations staff in with healthcare workers or first responders because they're transporting people to medical appointments and or to vaccinations. other county health organizations aren't buying it. So impediment in terms of inconsistency, right? And we, the state, really can't offer any guidance other than the high-level CDC guidance. And so it kind of puts us in a tricky position when you hear, well, such and such agency got their drivers vaccinated, how come we can't? That's the sense that makes it an impediment, I think I would say.
How about
Well,
some
that's
more?
an
I'm
argument.
sorry.
Sorry,
that.
I would just like to make the argument that's why we need it just across the board from the feds. Here's who, when people get vaccinated and the groups, and when you started going by job type, I think it would have just been easier to go by age period from the very beginning, and then we wouldn't have had any of this problem. But I think, now that we're into the job types, we need something across the board. It shouldn't be, because I know some people that have gone over the border from Iowa into Illinois to get vaccinated because they had more availability. And that's somebody in Illinois that didn't get a vaccine because someone from Iowa drove over there.
And so Mark and Jen in the chat are saying, that there's not really anything in the plans about transit.
Yeah. Hey, Caitlin, this is Jen. And here in Virginia, the transit workers are prioritized in phase 1B. What we're seeing is a difference between the health districts. Some of the health districts, the transit workers are already getting vaccinated, and in other health districts, they're being told that they have to wait, that they're following the order of the jobs, as Kristen just said, that are laid out in phase 1B. And so you're seeing different treatment in different parts of the state. And I think that's what's challenging right now, working with the transit agencies, because we worked really closely with the governor's office and got our transit workers prioritized. And so it's just the implementation is a bit lumpy.
Well, so that's our last question on here, Richard.
Yep.
CDC folks, what information can we provide to you? What have you heard here that maybe you want to hear more of? We can call on people, unmute them, and have them tell you what you need.
Oh, okay. Well, thank you very much, Caitlin. This has been really interesting. It brought up several things we have talked about. My immediate thought, I'd like to ask you all, and please, everyone chime in as needed, is our team is specifically at this time interested in the type of outreach we can do, what types of materials you would like, or how we could, of course, further vaccine update. Towards that end, right now we have something called an essential workers toolkit, which has some materials for reaching various types of workers. We can provide that. We'd love comments on that, or however you might think it might be more useful to you and the populations you work with. And I'll leave it at that right now. And actually, Liz works with communications there, and she also is working with other products we're developing right now. Do you have any other further ideas, Liz?
Well, I just wanted to note that I dropped a link to the toolkit into the chat. And we have all kinds of great things in here, including, there's a slide deck, we have key messages, we have, social media content, there are letters that employers can send to their employees. you can take these and customize them if needed. There's also a link to our myths and facts page, which may be helpful to share for people who may have concerns about specific aspects of the vaccine that may be contributing to hesitancy. We also have FAQ documents that can be downloaded and printed and shared. So would love for you to take a look at all the resources that are in here and let us know if you have any additional ideas. Another thing that we also like to talk about is, what can employers or agencies do to make vaccine confidence visible? And so that just might be a challenge for you all to think about. You'll notice that in our toolkit, we have some templates for stickers that people can take and work with a printer to print. And then once someone's been vaccinated, they can wear the sticker somewhere, place it somewhere prominently. We've actually seen these stickers start to appear all over social media, as healthcare workers have gotten vaccinated, they've been wearing them, so are there things that transit agencies can do to actually help make vaccine confidence visible, either on your buses or with your workers, or even thinking about, your leadership, having your leadership get vaccinated and, either filming it or taking a picture of it and publicizing that widely. So would just love for you all to sort of give some thought to that as well. What can we all do to help make it visible? And we know that, often people sharing stories and testimonials about why they decided to get vaccinated themselves can be a very powerful way to motivate others. So thanks.
Hey, I'd also like another thing that you did bring up. Please, any questions for Liz about the toolkit or anything, please let us know. We're looking for feedback on that. But the problem of crossing jurisdictions and the hodgepodge of things. Now, I know on the CDC website, we have a listing of all the different health departments and things there. Unfortunately, that seems to be always changing, but if that would be, I'm not sure if you're aware of that, but admittedly, I understand that we've heard that question from other organizations about the hodgepodge. Liz, do you have access to that page right now that you could?
Sure. Are you talking about the page where people can find a link to the specific page on their health department website about where they can get vaccinated? Sure. Let me find that and drop that in.
Right, the specific requirements.
All right. Well, thank you, everyone. And does anybody have any final questions before we move on to the rest of the agenda? I don't want to take up the whole time, but considering the situation in Tennessee, I'm thankful to Richard for letting me kind of talk about the results and air out all of the problems that we're having here. And thank you to our CDC friends for being with us as well. I may be sending y'all an email at some point asking for some advice. Any questions from anybody before we send it back to Don? All right, Don, it's all you.
Thank you very much, everyone. I know in Washington, we were once it hit that advocacy level with the unions, we were thanked very much to stay out of the way. And so it became very much something that was led by the association and them trying to both, advocate and work directly with their transits and developing relationships with whoever those local health departments were. We know of a handful of situations where they got in so good that when they had one of those weird situations where they open a pack of vaccines and there's an odd number left and an even number of people there, they say, send someone over. And so that the transits have kind of taken advantage of those relationships. Okay, let's switch back to our agenda and we'll roll through our work plan updates and emphasis areas. Richard, you want to start us off?
It would help if I unmute.
And but you know what? I was remiss. Thank you, everyone who participated in the conversation. Thank you to our guests from CDC. We really appreciate having you here. And thank you to Caitlin for organizing this information and sharing it with us. And I'm sure Richard did something too.
Richard.
Just a little bit. No, my thanks to the CDC and thanks to the folks for bringing this up. It also sparks an interesting idea for the technical initiative that I'll address soon. But just a quick start and a quick update on the work plan updates. In terms of communications, alerts. So we have 2 outstanding alerts. One was Indiana DOT and its request for a list of consultants. If you have someone you work with, someone you've known, or just you keep a list in your files of potential consultants you'd like to hire, please respond to this. This MTAP action alerts. They would like to gather these list of consultants so they can do some really broad outreach for a technical assistance RFP that they're about to issue. And they want to be open and they want to be transparent. So please respond to that alert. Lastly, in terms of alerts, the other one that's outstanding is the one related to transit photos that I sent out, I think like mid-January, that's coming due tomorrow. I'm happy to extend it if people are interested, but we like to use photos of transit in our various publications. Our main publication is the upcoming Survey of State Funding in Public Transportation, where we include just a whole lot of photos of our transit systems, of our facilities, our buses, our people. And so far, I've only received responses from Florida, Oregon, Vermont, Missouri, Connecticut, and then let's just say Colorado went way above and beyond what they've sent me so many photos that my head was going to explode. And they're great photos. They're fantastic, well, professional photos. So thank you for the states for sending them, but if others are interested, please send them, because I use them not only in the publications, but I also use them as part of all of our transit publications, from the e-news to the newsletter. We just need to keep our publications department, from using, let's just say, highway photos, when I don't want them using highway photos. So the more transit photos we have, the more the more we can use. So thank you. So please send them, folks, send them to me, and send them, and please respond to the action alert that was sent out in mid-January. On to membership updates. I think I updated the membership last month. I think at that time I stated that we had 38 paid members. Unfortunately, that number was off by 1. Our accounting department loves to just change things around on me without actually telling me. So I discovered that our paid membership is 37, and I've been doing a lot of outreach to members who have not been paid, who were paid as of, in 2019, or in this case, fiscal year 20, and for fiscal year 21, we're really off by about 10 members. So I'm gonna drop into the chat the MTAP membership list, and sorry, the membership map, just so you can see who's in, who's paid, who's not paid for the year. So please check it out. And if you see you haven't paid and you're planning on paying, or you thought you paid, please get with me and we can talk about membership. Nothing new on the website, except to continue to reiterate, I get really simple questions about people requesting information regarding contacts. All of our members of MTAP are all posted to the MTAP website. It's mtap.transportation.org. And if you need to find some specific contact on a specific issue related to your work, visit our MTAP Technical Assistance Directory on the Technical Initiatives webpage. You will find, and you can do a search there by functionality. So that's very handy as well. So please continue to use our website as a resource. That's what it's there for. Now on to MTAP budget. The last approved financial document, the financial statement I have is from December 2020. At that point, our revenues were 182,000. Our expenses were 54,037 for a net revenue of 127,963. Now, on the next agenda item, go back up the agenda. We have MTAP meetings. Last month, Scott Bogren talked about moving forward with the CTAA Expo from June 13th to 17th in Richmond, Virginia. And Jen, as much as I know we would love to come and visit and be there in person, all AASHTO meetings have been moved online through the end of June. So we're still planning to have the State DOT roundtable. It just is going to have to be in a virtual setting. And again, we're planning on having it as part of the expo. I'll be working with Scott and Chris and the great staff over at CTAA to make that happen. All right, next up, MTAP coordination. Speaking of CTAA.
Can we pause for a second?
Sure, of course.
On meetings, I'm assuming we still haven't heard anything from FTA on a summer meeting, because it would be their year, right?
Yeah, I have not heard anything from FTA yet. They're still in the planning phases.
Great, okay.
Just making a decision whether or not they want to go in person, they want to go virtual or hybrid. But we put forward, I think, preferential dates of end of July, early August as a preferred time slot. But again, we're one of 3 partners plus FTA. So we stay tuned for more details. I will follow up with them to see. Thank you for reminding me, but I hadn't heard from them recently, so we'll make that happen. All right. Can we move on to MTAP coordination? And if Charles Carr's still on the phone and has an update on CTAA, you can unmute.
Thanks, Richard. I hate to rush through it, but I've got another meeting I've got to get to. I heard you mention the CTAA Expo, so I wanted to mention something on that. The rodeo is scheduled, and they are still considering a few topic areas that we think are high priority. We can email with suggested topic areas, although most of the proposed topics have been fleshed out. The intensives are already set. Want to make you aware that CTAA is undergoing an extensive excuse me, review of its planning process. We're looking at how we can do a in-depth strategic plan. There's a consultant group, I think it's S Brands Consultants, that have been retained to do that. Some of you have been submitted as potential candidates for interviews, person-to-person interviews. There will be a part of the process of gathering information will be surveys that will be open to the public. We're encouraging folks to participate in that. Scott, through either Scott or Charles Dixon or one of the others, are going to notify folks officially when that set of surveys is up and running. But again, it's from S Brand. It's a pretty accomplished consulting firm that has done wonderful work in this regard. So we strongly encourage, whether you are a DOT rep or whether you've got some representatives in your agency who have attended, or even if you got subrecipients, which is, I guess, the most of us fund a significant number of subrecipients. They want to get as much input as they can to guide the direction of CTA's next strategic planning efforts. That's pretty much all I've got for now. And I really hate to beg off, but we're in the middle of a legislative budget session. So I'm going to have to go back in and see if I still have a job.
Well, didn't mean to laugh. I hope you're kidding.
But that's okay. And Richard, one final thing. Our payment it's not literally in the mail. It will be sent by the end of the week. It's been approved.
All right. Jen, the update from APTA?
I'll be really quick on APTA. Obviously, APTA is working a lot on additional COVID relief. I believe they're looking at another 30 billion potentially in a relief package. Changes in leadership at APTA. Also because the APTA chair is now the acting FTA administrator. So I think there's some shifting around going in board positions, but I would say working on that additional COVID relief is the biggest item on the agenda.
All right. Don, anything on
Sure.
anything new about National RTAP?
Yeah, some of the highlights from National RTAP are for their upcoming events. They have a Cybersecurity 101 course coming up on the 11th. So this week. And so, and with a special note that webinar will not be recorded. And so I think it might be helpful to point some of your rural systems in that direction. There's an intercity bus roundtable coming up on March 9th. I know lots of us are constantly talking about this right now. I know the intercity bus industry is really struggling as we come down the stretch. And I'm not just talking about the dog either. I'm talking about all of our providers who I know, for example, are not paying rent at many of their transit centers right now where they have space. And so I think it'll be interesting to understand the state of the industry. And then finally, one fun thing I saw on the list of upcoming events for RTAP is they're doing a climate change and transit Twitter chat coming up on April 20th. From the newly updated or recently completed events, they recently completed a rural transit manager's toolkit. And I think that's kind of like their equivalent of our FTA 101 training that they give for new rural transit managers. And as well as they have a webinar available that explains what's in it. And another fun thing that they recently completed was microtransit and rural mobility and how those two things can work together, all available on their website.
All right. Now open discussion, I guess, for all members who want to talk about what's happening with FTA. If there's anything anybody wants to mention, I know they're having their second stakeholders call right in about another minute or so. So hopefully you have staff assigned to attend and listen on that one if you didn't attend the last one, which was last week. But I assume it's going to be the same information if you've attended, so I wouldn't worry too much about that. But if you need to drop off this call, please feel free and go on to that other one. We know it's important. We know the information you're sharing is important to your systems, to you and your systems. But just to move on to, so if there's any other issues that anybody wants to raise about FTA.
Richard, would this be an appropriate point to talk about some of the House T&I proposal that I received from a few different people for the next round of stimulus that'll sort of divvy up that 40 billion?
If we could hold that to the other ideas section, that'd be great.
Sure.
And now, because I'm going to run through this other stuff quite quickly. In terms of technical initiatives, just two ideas that are germinating in terms of upcoming webinars and things that we want to have, I would like to work on your behalf. Is sort of, I heard what you were saying when we did the survey about what topics of interest were for the winter meeting. And let's continue to carry those issues, the ones that didn't get used, forward for the next fiscal. So one of the next ones coming up, the topic is multimodal transit planning and statewide transportation plans. So that my goal is to try to work on a webinar for members on that particular topic. But then also Shane raised a good topic and kind of, about how North Carolina DOT is being discussed as a best practice in terms of coordinating and transit accessibility to COVID vaccine sites. And now that we heard Tori Mill from Minnesota, she further confirms that state DOTs are playing a significant role. So I mean, I might try to sign them both up and do a best practices on transit accessibility to COVID vaccine website, COVID vaccine sites. Perhaps hold a webinar on that particular topic with no objections. And also under this effort is you should know that we understand that that we need to continually add value or show value for MTAP. And part of that is, and what we've heard before is that there's a need for training. And I'm letting you know that we'll be issuing another, hopefully not all MTAP action alert out, but issuing another MTAP action alert to get the input from members about ideas for a new training module similar to the FTA 101, but I'm calling it the FTA 201. So a more advanced learning, sort of get your priorities in terms of what issues you would like to see incorporated in that. And then of course, what are your values? What do you value about the kind of training that we would be looking to do? It would be sort of, again, similar to the FTA 101, a 1 hour long with testing capabilities, as well as links to sites where you could learn more information about certain topics. And I've had the conversation with the North Dakota State University, the Small Urban Rural Mobility Center, which used to be CertTech, it's now CertCom. And they asked if we would just survey the members, so I agreed to that. And that survey will be going out either today or tomorrow morning. I figured I'd hold it until after this meeting so I can explain a little bit more about that. But stay tuned, folks who are still on the phone. That please respond to that, because like the COVID vaccine action, the more members who give us input about this, the better off this training module will be in the end. Next up on the topic is research. I know Charles had to beg off, but we announced in the MTAP e-news what will our research priorities be for fiscal year 2022. And we are going to be, in terms of priority order, members ranked sustaining zero fare public transportation programs in a post-COVID-19 world. That is going to be our #1 priority for this upcoming research cycle, followed closely by benefits analysis of private health sector investments in public/human transportation. Third ranked was planning and innovative and emerging mobility futures at intermodal passenger facilities. And last but not least, return on investment and economic impact of travel demand management programs. What's going to be next is that all these priorities have been ranked, and these rankings have been provided to AASHTO's Research Advisory Committee, as well as its Special Committee on Research and Innovation. They're going to get together, they're going to discuss it, and they're going to come up with a holistic ranking of all problem statements and all research projects that were submitted. And we will be participating in future meetings of the NCHRP to ensure that some of these projects will get funded. So keep your fingers crossed. I think these have got a lot of promise for this year. Are there any questions? And that, of course, that discussion will take place in, I think, the April timeframe. I think they hold their meeting in like mid-April. But stay tuned. We will distribute additional information about that. The last thing on research is that there's a deadline of February 17th if you are interested in proposing an NCHRP synthesis topic. What does that mean? Basically, you need to, is there a topic that you're interested in that you want to document current state of practice, not necessarily best practice, but current state of practice, something that is timely and critical for the delivery of projects, the improved quality or lowering of cost of a particular project or a particular issue. So if you feel that there is something, feel free to send me an email, and I'll send you the link to introduce introduce your topic as a synthesis topic. Are there any questions? All right, hearing none, Dave, I will now turn the floor over to you under other ideas and announcements.
I just wanted to make everyone aware that there's some proposed language from House T&I regarding how they're going to distribute the transit funds. And it seems like, although it's skewed to 2018 operating expenditures, it's there's still opportunity that every state will at least get something. I went through the calculation, and so 5311, we normally receive about 12 million. We would receive about 2.4 or 5 million based on what was proposed. Our percentage of the percentage of CARES we received, we didn't receive any PRISA because we were over the allocation, the 125%. We received 147%. So we were in a sort of a middle group where we would receive about, I think it was 20% of our 10% of our 2018 operating expenditures. That's the what they're using as, so you'll receive a certain percentage of the operating expenditures you had in 2018, and you'll fall into like one of three categories. So if that's available or you need to find it, let Richard know. And they have it in there for the urbans as well, and what they would receive. So for New Mexico, just looking at the rural, we would be receiving 10% of our 2018 operating expenditures, which in our case, it's fine. So that is all.
All right, Don, back to you.
All right. I think, I'm sorry, I need to see one thing. What the fudge? Are we wrapping up at this point? I can't see the bottom of the agenda.
That is it.
Yes. All right. Thank you, everybody. I'm off to lunch. Enjoy your cold, enjoy your wet, enjoy your sun, whatever you happen to have at this moment. Oh, I see there's a hand up. Tori, did you want to share something? Oh, and there it goes. Okay.
Yeah, I was just gonna share something, you guys. Our transit agencies, it's like family to us, right? So we just had a tragedy. There was a shooter at a clinic in one of the cities in Minnesota, and the guy that did the shooting also had some explosives. He took one of our buses to the clinic. So it's on the news right now, and so our community shook up a little bit. But so I mean, I guess you guys would all feel my my angst here and my worry. And yeah, so the driver has been pulled off the road, and they are talking to him. Yeah, but he's shook up too. So just wanted to share that little bit of scariness with our world right now. So that's all I had. Sorry to ruin the meeting.
Well, Tori, our thoughts are with you and with the folks that you work with. Thank you for giving us the update. With that, I think I will let us go.
We are adjourned, and go join the FTA stakeholders call if you haven't joined that yet. Thank you. Have a great day, everybody, and talk to you next month.
Thank you all. Thank you.